First, you have to understand, Mr. Tapas Chatterjee, your father, you have seen there are 4 or 5 situations have happened in his life which he has recovered in more difficult situations. So sometimes, your own body, becomes more powerful than actually the treatment. He has already proved in his past 3-4 experience in critical case situation which he has presented to us that he has recovered. Every time he had come with a critical situation, but this time what happened, he came in an altered sensorium. And already we know that he has got a background disease or dementia, which is progressive. Because there is no active treatment for dementia, because as a good daughter, you have been working very hard for your father for last so many years. But this time what happened, whenever he has an altered sensorium, we found that his acid level went very high in the body. Now acid level goes very high, usually when the kidney is not functioning very well. This is one of the reasons. So we found that he's in an acute kidney dysfunction. Already he has got a stable kidney dysfunction, what you call chronic renal disease, that has worsened. So then I already told you that if you really want to take him out of his crisis, we have to dialysis him. And you have found that after 2 dialysis he recovered. Yes. And after that I stopped it. I said, why I have done a dialysis? Because I know he's a strong man. He has come out couple of times in more difficult situations. Yes. So keeping his core strength in mind, I have dialyzed him and I found he improved. He improved neurologically, he improved functionally, all the parameters improved. At the same time, we have found that with his kidney dysfunction, when we did his CT scan of the head, we found that multiple areas of the brain has developed some clots. These are called infarcts. Infarct means the sudden supply of the brain is not getting supplied. Dementia on the background of infarct is a bad sign. That means already the brain is slowing down. On the top of it, there is an infarction. Infarction means decreased blood supply to the brain. And brain is like a watershed area because the already blood supply to the distal part of the brain as we grow older becomes sluggish. On the top of it, there is a sudden cup or less supply, the brain gets more affected. So we expect his dementia to worsen after an infarct. That is a different. But one thing which is biggest challenging is that he came with acute acid retention, he has recovered. He came with a drop-in pulse, which is recovered partially. He improved with infection, which is recovered. Then we found that his other metabolic parameters were worsening, he's improved. But now what is found that once we shifted him to the ICU, that we found his sensorium is not improving that significantly, level of alertness. And this is little fluctuating. So we took an opinion of a neurologist, he's a senior neurologist. He said that, Dr. Bose, whenever you have fluctuating sensorium, that means there is something which is fluctuating in the body. And there are so many things in his body which can fluctuate, the kidney function and the metabolic functions and all those things. But we have found that his kidney function has stabilized to 3.1 because he has been in 3.1 for last so many years. But now the biggest challenge we have found that what could be one of the reasons is that already the brain has got less blood supply. On the top of it, what is the organ which pushes the blood to the brain is the heart. But we found that heart rate is persistently low. And it is not because of the drugs we thought initially. We are already giving Alupent is a drug which can stimulate the heart. But this drop in the pulse rate is because of heart block. This is called complete heart block. That means heart is not able to function effectively as a rhythm or what is called as a symphony. The smaller chamber and the bigger chamber is not working together. They behave. Whenever this situation happens, the blood supply to the brain further comes down. Already he has got an infarct. On the top of it, he has a heart block. So only thing which I can think of, kidney has stabilized, his urea is also settling. In fact, nothing much we can do as per the neurologist. The only thing which is reversible I can think of is putting him into a pacemaker. So that's why I discussed with Dr. Vinod Sharma. He will be speaking to you. I spoke to him. Dr. Naren will take the ECG and discuss with him. But by giving a pacemaker, we'll make it a normal heart because otherwise the heart functions are normal. Only thing, the rhythm we have to improve. So once we improve the rhythm, you never know his blood supply to the brain improve. So what I'm trying to say, I know it's a very difficult situation as a daughter. If we take the different organs are degenerating, the heart is degenerating, kidney is degenerating, but still so far the life is there and he has already improved in last couple of situations. This time also from an emergency has improved. We should try our best. So I feel that we should put him onto a temporary pacemaker and see how is he behaving. So in nutshell, what I want to tell you is that we have to do our best. A doctor can only think of treating the disease. Cure is almighty. So that's why we say that we treat, he cures. So empathetically, I'm educating you on a piece of paper is that neurologist says that whatever happened to the brain, already he's on Donep, that is more than enough. Kidney doctors are saying that already his kidney function stable, that is more than enough. But all these things are also creating some disbalance. But what is a little reversible or salvageable is maybe the heart rate. If I can improve the heart rate to 70, 80, things can improve. So my take is that let's take the opinion of the cardiologist. If the cardiologist says I improve the heart rate, then it improves. So I think we should work on that.
Sir, I am not consulting any of the doctor. I once spoke.
You know, you have a full faith on me. I am not working as a super specialist here. I am a pulmonologist. I am working as a physician who understand all these components, because this is my specialty to get coordinated with all the specialty, because pulmonology comes under critical care. So he's have got this thing. So let's see. Let's do one, two things. Professor, Puri has seen, he's a neurologist. Anwar has seen the nephro part and his team. I'm coordinating. Let's see what Dr. Vinod Sharma is seeing. So he's in next room. Let's take his opinion. If he said I will put a pacemaker, we'll do it. We'll see.
Sir, whatever you say, I'll go by that.
Okay. So
Yes,
we will go for
hello.
it. Just show the
हाँ.
ECG, and we will take a call and we'll put it temporary.
उषा गुप्ता सी विंग फर्स्ट में है
Sir, with this pacemaker,
101 हाँ वहाँ से वो शिफ्ट हो
No,
गई
already the line is there. It is
B
very
wing-
simple.
B
We have
wing
to
में,
put
B wing
everything.
and he will be going back home with the
हाँ
pacemaker.
देखना पड़ेगा अभी मैं
Then we
देखा
have to put
नहीं
it in the permanent one.
ओके
That you will take a call
Yeah.
later.
So right now we are going to put a temporary pacemaker to improve the heart rate. That is the only thing which you can do. Okay? So good. Come.